each were unique and a powerful voice, which today we are all contributing to awareness, dignity, and empowering women. And all that I have to say is that this is not just like a health issue in person. It's a public health issue, and it's human right issue too at the same time, because several girls in India face still shame, silence, and stigma. And while I was looking through the statistics, I realized that when we talk about the menstrual issues, almost 50% of the young adolescents girl were unaware of the menstruation before the first period. And some statistics which was done, I think in the 2000 last NFHS 5 19 to 21, that showed that sanitary napkins was being used in almost just half of the areas in the rural, as compared to two-third in the urban areas. So two-third of the women, yeah, were using unlike them. And so the story talks about the unhygienic materials being used like cloth, husk, etc., and giving rise to issues. And also I was reading in one of the statistics that almost close to a quarter of 20 to 25% of the girls actually have school dropouts after they start menstruating because of fear and all. And we all know that anemia in young girls is allowed 50%, as per the, again, the latest NFHS 5 data. And these huge things talk about how important it is for us to give this information about this. But having said that, India is on a change, India is on a rising tide. And as I was talking just some time back, that we are now the fourth largest, I mean, the economy in the world. And the amount of stupendous steps that India has made is truly applaudable. So, what have we seen in the positive effects in menstrual is that ASHA workers are not now giving the low cost sanitary napkins, and the Swachh Abhiyan, which was started by Honorable Modi ji. Through that, also toilets are being, several toilets were created in schools, and that was a beautiful endeavor in the last few years that we've been seeing. And again, we've been talking about two schemes which are very important: the Suvidha, which allows you to get the biodegradable pads, and also the several NGOs and societies which are coming together as partnership with the government to take this forward. And these are all the positive steps that we've seen in India in the last few years. And I'm sure with the efforts of all of you all and the way the IAP is working through its vast majority of pediatricians who, besides their regular practice, they take out time for social activities. They come over such platforms, and the effort which Westerly made in going for 5 days to various school and doing the hands-on training. I salute you all for that efforts. And they say Mount Everest was not climbed at a time, and individually we are no one, but together, the way we perform, we are able to take care of hurdles. And that's how I've been told that even the neonatal mortality is soon going to be, in a couple of years, the dream that we want a single digit is we're just around the corner, and we are doing. So with that, I wish you all great best wishes and more power to the West Delhi team, that such activities, such endeavors to back this young girls, so that we are able to address issues of anemia, infection, dropout, self-esteem, mental health, all this, and bring about a basic change in the society, because the future, these girls are going to be the strong pillars of the families, and they are the ones who are going to support and talk about health issues to their families. So this movement that we've seen in India with the largest insurance policy in the world of Ayushman Bharat in this scheme and the digital health mission, I'm proud, extremely proud that I'm here to envisage and to see how beautiful our country is doing. And the pediatricians, how beautifully they are connected under the platform of IAP to bring about such changes in the community. And that's all I would say and close up to wishing you all more and more power to everyone on this platform. Thank you once again.
Thank you so much, Dr. Neelam, and I would like you to stay till our Saraswati Vandana and the songs.
Yes.
And please
And I
continue,
would like to say
Radhika.
that I am outside somewhere, but I had committed, and this issue was something which was so dear. Trying to do social activities, sometimes you don't realize where there's a gray line. So, as I mentioned, I sent my this thing. Our intentions are good, but we don't want to hurt anyone. So, inadvertently, something which, in our effort to do social work, should never be mistaken. So, thank you for that understanding.
Thank you so much, Dr. Neelam Mohan.
Nice
And
work.
Dr. Neelam Mohan is our very dear and powerful President-elect 2025. And she is the pioneer hepatologist and liver transplant surgeon, transplant
I
specialist.
want to share my slide, Rohit.
Mr. Rohit?
Rohit, give me a chance to share the
You
this
can
thing
share
that
the
we
slide.
uh, Can you see my slides?
Yes, ma'am. Slide share can be started,
Hmm.
Mr. Rohit.
Yes,
Yeah.
start.
So she's the pioneer in pediatric hepatology and liver transplantation. She's senior director and head of the Department of Pediatric Gastroenterology, Hepatology, and Liver Transplantation, and the prestigious award winner of Dr. B.C. Roy Award. So thank you, ma'am, for your kind words, and I hope we'll be able to celebrate Menstrual Day as one of the IAP days in near future. Thank you so much, ma'am.
Absolutely.
I would now
Next year,
like to.
we want it in presidential election plan. It will be really great. Next.
Absolutely. You too deserve to be leading that with your endeavors. So prepare yourself some agenda and all for the next year because
Thank you very
it's
much.
totally, it's, as I said, it's a public health issue. It's not only an educational activity that you're taking. It's not only an educational, but a huge public health issue which needs to be addressed. And I salute for that thoughts.
Next.
Thank you so much, ma'am. I would like to welcome Dr. Alok Bhandari, sir. Sir is the senior pediatrician and neonatologist, past president IIP West Delhi and IIP Delhi State, and has multiple accomplishments. He's our guest of honor for today. Sir, please enlighten us with your
Dynamic
kind words.
Alokji, wishing you best in all your endeavors.
Thank you,
Dr.
ma'am.
Alok Bhandari, sir. Bhandari, sir. He's not there.
Dr. Alok, sir.
So continue with Deepmala,
It's not
Dr. Deep. Okay. Dr. Bhandari, sir.
Dr. Bhandari, sir.
Hey, he's there.
He's there. He's logged in, but Dr.
Dr.
Bhandari,
Puneet, can
sir.
you?
Yeah. I'll just call him.
And the second guest of honor for today is Dr. Deepmala. We heard her. Thank you, ma'am, for joining with your such a busy schedule. She's leading our IMA Dwarka. She's the president of IMA Dwarka and has a lot of things to her credit. She keeps on doing a lot of social activities and ensures that all the junior doctors are given equal participation in all the activities. That is the very great thing of IMA Dwarka. Thank you, ma'am, for joining.
Dr.
Dr.
Deepmala,
Alok.
few words. Dr. Alok Bhandari. Dr. Deepmala, few words.
Okay, ma'am. I think
We start with our Saraswati Vandana.
Yes, ma'am. Let me
I'm
first.
stopping to share.
Ma'am, next slide.
अच्छा, नहीं, you just start with Saraswati Vandana. Now it comes
जी.
to
Rohit Saraswati Vandana.
this Saraswati Vandana is our own. Dr. Rivdaman has sang it and it's so beautifully done.
Dr. Ripudaman is a senior pediatrician and our EB member.
या कुण्डेन्दु तुषारहार धवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युत शङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मा पातु सरस्वती भगवती निःशेषजाड्यापहा। या कुण्डेन्दु तुषारहार धवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युत शङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मा पातु सरस्वती भगवती निःशेषजाड्यापहा।
It's time for our IAP anthem. The lyrics were written by Dr. Smita Mishra, ma'am.
IAP का यही आह्वान, हर बच्चे की अपनी उड़ान। IAP का यही आह्वान, हर बच्चे की अपनी उड़ान। हम रहे सेवा को तत्पर, रहे सदा आगे बढ़कर। हम रहे सेवा को तत्पर, रहे सदा आगे बढ़कर। संक्रमण कुपोषण आदि इनका करे निदान। IAP का है यही मकसद, स्वस्थ शिशु बने देश की शान। IAP का यही आह्वान, हर बच्चे की अपनी उड़ान। IAP का यही आह्वान, हर बच्चे की अपनी उड़ान। जननी शिशु रहे सुरक्षित, माए कराए स्तनपान। जीवन रक्षक घोल पिलाए, बचाए उनकी जान। टीकाकरण हो घर घर में, बीमारियों से करे सावधान। IAP का यही आह्वान, हर बच्चे की अपनी उड़ान। IAP का यही आह्वान, हर बच्चे
phenomenal.
अपनी उड़ान, हर बच्चे की अपनी उड़ान, हर बच्चे की अपनी उड़ान।
इसके बाद एक बहुत खास गाना है जो डॉक्टर स्मिता मिश्रा मैम ने मासिक धर्म के ऊपर बनाया है, मेंस्ट्रुएशन के ऊपर, एंड आई थिंक इट विल रेजोनेट विद ऑल ऑफ अस।
हा 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 है 28 दिन में जो वो आए, 5 दिन तक न जाए, रक्त इस तरह है एक सजा तो सिम्मी सोचे सिर झुकाए, क्यों मासिक धर्म का रोग लगा, दर्द पेट पिंडलियां करती है, मरोड़ सी आंतों में उठती है। अम्मा मैं कैसे कमरे से निकलूं, कैसे पापा भाई से बात करूं, स्कूल में नहीं जाऊंगी, बिस्तर से क्लास लगाऊंगी, भाभी और अम्मा खूब हंसी। मासिक धर्म है रोग नहीं, सिम्मी तू ना डर, और सबसे बात कर, ला 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 ला। जैसे हम धीरे धीरे बढ़ते हैं, शरीर के फंक्शन बदलते हैं, पिट्यूटरी हाइपोथैलेमस बनाते हैं चक्र अंडाशय के साथ, तो अगर गर्भाधान हो, गर्भाशय उपयुक्त तैयार हो, गर नहीं हो गर्भधारण तो मासिक धर्म रक्त स्त्राव सिम्मी, ये है साइंस की बात, बायोलॉजी की फिलॉसफी, रक्त स्त्राव में है सृष्टि की खूबसूरत कारीगरी। 10 से 16 साल के दौरान होते हैं मिनारकी के प्रभाव, सोच सोच सिम्मी इसमें तू ना रोना, यह है पूरे विकास का होना। अब बिटियां तू शान से जी, सोच माहवारी का रूल तू सीख, साफ सुथरे हो पैड सदा, 4-5 घंटे में जाए बदला, सादे पानी से योनि की सफाई, धोए हाथ साबुन से पैड के पहले और बाद में भी, पैड को लपेटो साफ कवर में और फेंको डस्टबिन में। दिन में 1 या 2 बार नहाना नहीं मना है, रसोई में जाना जरूरी हो तो आराम तो करना, आयरन की गोली भी खाओ, एनीमिया को दूर भगाओ, तो सुन सिम्मी है। 28 दिन थोड़ा आगे रहो पीछे, 5 दिनों से थोड़ा आगे रहो पीछे, तो सिम्मी तू ना घबराए, जा सिम्मी अब स्कूल भी जा, पानी पीना अच्छा ताजा खाना, हरी सब्जियां ताजे फल, दही पनीर और पौष्टिक भोजन, जो तू खाए तो दर्द भी जाए, कमजोरी भी पास ना आए। माहवारी है गर्भ स्त्रीत्व का, नहीं है ये कमजोरी या दुर्भाग्य सिका, ये नहीं है वो मन की बात, पर ये है वो मन की बात। ला 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 ला।
No words for that. I think it was very powerful message.
स्मिता तो गलती से डॉक्टर बन गए,
डेफिनेटली।
मतलब
नहीं,
इतनी
मैडम के लेफ्ट एंड राइट
इनोवेटिव,
ब्रेन दोनों इक्वली सुपर्ब हैं।
बहुत ही आई मीन अमेजिंग है, यू आर रियली टू गुड,
Thank you so much.
bless you with more.
So, Radhika, introduce our team and then continue with the rest of things.
So I think we all know our president, dynamic president, poetess, cardiologist. Madam is HOD, head of the department, pediatric cardiology, Manipal Hospital, and I am the secretary. Dr. Richa Parashar is the president-elect. Dr. Samarjit Grover, our finance secretary. Dr. Puneet Kumar, our editor and our encyclopedia, and our other IAEB members are Dr. Ripudaman Kaur, Dr. Rashmi Gandhi ma'am, Dr. Rashmi Grover.
Ex officio, Dr. Dinesh Goyal and Maninder, please don't forget them.
Yes, yes. Dr. Maninder and
Uh,
Dr. Dinesh are always with us,
uh,
physically as well as mentally. And
yeah.
Dr. Prashant Seth, Dr. Gagan Malhotra, and Dr. Shravan Gupta. And our
Dr.
advisors are,
Rashmi Gandhi. 1 minute, can you see my slides, Radhika?
ma'am, I'm not able to see properly. That is why
Oh,
probably.
that is the reason. Yeah, yeah, yeah. Anybody else
One,
can see, ma'am, Neelam? Can you
I
see
can
my?
see. I can
Yeah.
see.
ma'am, we can
Okay.
see.
The
Okay.
executive member
Okay,
you
now,
put
yes,
there.
ma'am. The executive
Yeah.
board members are Dr. Prashant Seth, sir, Dr. Rashmi Grover, ma'am, Dr. Shravan Gupta, Dr. Ripudaman Kaur, Dr. Gagan Malhotra, and Dr. Rashmi Gandhi, ma'am.
Our advisors. Yeah.
Advisors are Dr. Alok Bhandari, sir. As always, Dr. Deepak Gautam, sir, Dr. Piyush Khanna, Dr. Sandeep Taneja, Dr. Manish Chopra, Dr. Uttam Pal, sir, Dr. Vineet Sehgal, sir, Dr. Vikas Taneja, sir, and Dr. Lalit Mendiratta, sir. And
Uh,
our co-op members who are equally participating are Dr. Pankaj Goyal, Dr. Ram Asre, Dr. Shweta Gupta, Dr. Sunil Bhasin, sir, Dr. Vishal Vaidya, Dr. Vikram Gagneja, and Dr. Ritu Chawla, ma'am.
That is the
So,
reason why we are performing well, because very power pack people over here.
so now I would like to hand over to Smita, ma'am,
Dr.
to
Bhandari,
please,
if he is there, to please few words.
Dr.
Dr.
Alok
Bhandari, sir.
Bhandari, sir.
Dr. Deepmala. Okay. So my panelist for today is included Dr. Radhika is our panelist also. So you know her quite well. So I asked for the message and I'm going to read only message from our panelists. What would they like to say to GOI? So Radhika tells that healthy girls, strong nation, let's make India period friendly. And message for the women and girls is period hygiene is a right and empower every girl. My message, my what is my achievement is the mother of a daughter and raising a girl child is fun and challenge. Then coming to my message to government of India, you are doing well in Delhi, but see towards the periphery also. And message in the for the women and girls, menstruation is empowering. It means completeness, complete womanhood, and embodiment of compassion because it comes with the womanhood. It is not always to make to give birth to a child, but be always a mother to child emotionally. That is most important. Our very I what should I say that we are lucky to have her over here, Dr. Lieutenant Colonel Leena and Sridhar. And she's my colleague over here in Manipal Hospital, multiple actually achievement. So she's member of SRCIC at the MSD Executive Board member, multidisciplinary committee. She's looking after over here. Superhero White Coat Award. She got the API Abdul Kalam Appreciation Award was given to her, and she is alumni of the Maulana Azad Medical College. Ma'am, I'm sorry, I'm not reading the whole biodata because you have lot of publication and lot of. So coming to Vijay Lakshmi. So this is a really for us. Radhika will agree that it is a game changer for us. The kind of work they are doing, Amod and Vijay Lakshmi Poddar. Again, she has started and now created such a big institution that is the Stand and Stride Foundation, Dwarka, and she is looking after the health part of it under Ayushman her own Ayushman scheme, and she has given message to GOI that promote menstrual education, support local initiative and NGOs, launch sustained nationwide campaign and schools, college that normalize menstruation. And for the girl and woman, she says that know your body, prioritize self care, break this stigma, and celebrate your womanhood. Now coming to Tulika, Tulika is personal friend also because of her work only. So that is how we came together. And she is, I'm sorry for the spelling, the mother of two boys and a fervent reader and seeker of truth. And that has led to wonderful scriptures of great land of India in fun-filled and colorful ways. She is publishing the books. So, and I'm very impressed by the Hanuman Chalisa. I bought it also. Anjali, I have put your this one also. So this profile I got later, and she is a social activist, highly qualified, and we have seen the way she is working in Goonj, and I think Goonj has created a lot of ripple all over India by its work. So really, we welcome Dr. Anjali, Miss Anjali Agrawal for this symposia. And her message to GOI is ban the plastic-based sanitary napkins and make affordable biodegradable pads. Message for the girls and women regarding the menstrual hygiene. Menstruation is a human issue, not the woman issue. And this is the line which I actually not stolen but borrowed from her for my song. Hence, do not feel shy, ashamed to normalize to raise your concern and requirement with male members of the family, school, and society. Nana Vivek Dave is a clinical child psychologist and really having good fame in this area. So, because I didn't get her message, so I got a message for her from the net, and one of the patient is saying very satisfactory like observation. I have been several therapists over the course of my life, but none for as long as consistently as I have seen Miss Nana. She is truly amazing. You know, she's sincerely cares about you. I have been visiting her for the multiple sessions, so I'm impressed by this biodata. Swati is my own, like we have worked together, and she is a BLK Max super specialist and super specialty hospital. She is also affiliated with Madhukar, Rainbow, Apollo, Fortis Health Farm, multiple places. So, what is Swati? Swati is quite accomplished. I am not going to read biodata. Any message? It is very important to give information regarding body changes and periods in a school. Early pubertal changes should be noted by parents and timely intervene. Madam Mithu Dole, actually, she joined us little late, but I'm so happy that she agreed to. And she is working with the Venkateshwar International School Secretariat in Dwarka. She is MSc and BA. And message to GOI, she says that to empower our Anganwadi workers so that they can spread the awareness of menstrual hygiene to the underprivileged girl in the remote corner of India. I also asked for the message to the girls and women. So she says, do not fear or feel ashamed of you. It is you who will help in the growth of a strong nation by ensuring the continuity of human race. It is blessing in disguise. Be strong and be resilient. So, Madam Lina ma'am, what is the menstruation and what is the menstrual cycle? We are starting with the question. Lina ma'am. Lina ma'am.
Lena ma'am.
And Dr. Lina, ma'am.
Well, then Radhika, you start. Then when she comes back. So, Radhika, what are the systemic disorder which may affect the onset of menstruation?
So, a lot of systemic disorders affect menstruation. They are of different categories, like the endocrine disorders. Most common these days is the PCOS, that is the polycystic ovarian syndrome, and most adolescent girls get affected by it, and usually presents with acne, hirsutism, obesity, and insulin resistance. Second comes the thyroid disorders, hypothyroidism. That means the lack of hypothyroid hormone activity, which usually causes increased bleeding or menorrhagia or irregular cycles or frequent bleeding. And then is the hyperthyroidism, which causes scanty bleeding or even amenorrhea or oligomenorrhea. Then comes the diabetes mellitus, which is very commonly seeing the type 1 diabetes mellitus as well as type 2 diabetes mellitus. Because of the poor glycemic control, there is insulin resistance and it affects the hypothalamic pituitary axis, causing menstrual irregularities. Then comes the congenital adrenal hyperplasia. That is again an endocrinal issue. And because of the androgen excess, there is amenorrhea or virilization in girls. Next are some common hematological disorders. Very commonly, we see many girls with like severe bleedings. And when we take the history, we come to know that even the mothers suffer from such kind of illness, such kind of excessive bleeding. And we come to know that von Willebrand's disease is one of the commonest hematological disorder causing excess bleeding in females. Then comes thrombocytopenia, that is decreased platelet counts, or other coagulopathies which cause menstrual abnormalities.
You were
And
muted,
certain
Swati.
nutritional and metabolic disorders. So, eating behaviors like anorexia nervosa, bulimia, they cause there is sugar deficiency, energy deficiency. So that causes disturbances in the hypothalamic pituitary axis and menstrual abnormalities, and at times amenorrhea also. Even obesity is a nutritional disorder that causes insulin resistance and same PCOS like symptoms, on which Dr. Leena Sridhar is going to tell us soon. Then comes malnutrition and micronutrient deficiencies, especially iron and zinc deficiencies that can cause anemia and that can cause delayed menarche. Then certain drugs like the epileptic girls who are on valporate can have PCOS like symptoms. Then children who have had surgery or especially pituitary surgery or even chemotherapeutic agents or who are on steroids, again those affect the pituitary hypothalamic axis and can cause change in menstruation. Then certain chronic disorders like chronic kidney disease, like uremia affects the hypothalamic pituitary axis. Then cystic fibrosis, which is a malabsorption syndrome, which again causes menstrual abnormalities. Chronic liver disease, which causes different estrogen metabolism, thereby affecting the bleeding cycles. So these are, I think, the most commonly affecting. Then also persistent, very severe exercises, like those who have got very severe exercise schedules, they can have delayed menstruation. Obesity can cause early menstruation. Then one genetic cause, Turner syndrome. At Turner syndrome is also a finding which we at times miss to pick up, and we pick up when the child or the adolescent comes, girls come with amenorrhea. So I think these are in brief the disorders which cause changes in menstruation or delayed or
Thank you so
early
much, Radhika.
menstruation.
Very comprehensive, actually. And now, Dr. Leena, we were trying to actually get you because
Yeah, yeah,
the
yeah. I
start
was
was
very much
from you.
late.
Yeah. What is menstruation and what is the just let us know what exactly we are talking about.
Okay. So thank you very much. And it's such lovely that, the menstruation day is 28 or 28th of May, like Dr. Neelam had mentioned, 28 days because the normal length of a menstruation cycle is supposed to be 28 days. So this is what we call menstruation or a period. This is the normal, vaginal bleeding that is occurring as a part of a woman's monthly cycle. So what happens is, in simple language, every month the body prepares for a pregnancy. So if no pregnancy occurs, the uterus, or what we call the womb, it sheds its lining. And this menstrual blood is partly blood and partly certain tissue which comes out from the uterus. And since it occurs in 28, it's roughly a 28-day cycle. So we call it a menstrual cycle. And the first day of the cycle starts from the first day of the periods, and it is right up to the first day of the next menstrual cycle. So this is what we, in simple way, what we meant by saying menstruation. And what I'd like to emphasize is this is a very healthy thing which is happening in a woman, and the connection of menstruation should be with a healthy woman. That should be our connect, and not that there is something abnormal that is happening.
Thank you so much for Dr. Lina for very comprehensive explaining about the menstrual cycle, and as well as a message that it should be, it is physiological and should remain physiological. This is what. So, Methu ma'am, did you encounter first time menstruation happening in a child who is actually unaware? Then how did you manage, and what was your impression about the situation?
Good afternoon to all the eminent panelists. It's my privilege that I'm able to learn a lot from this session. Coming back to your question, yes, very rarely, although, because we start our, our workshops on menstrual hygiene when the child is about 9 or 10 years old, from class fifth. So they are already aware of it, whether it comes from the school or from the parents. A class fifth child knows what it is, and if there is a any sign or symptom, where to approach, whom to go to, and we have not faced as such any major problem. Yes, one odd case when there is a issue when the child is totally unaware, and that is the time when the class friends will inform the teacher, and we do the needful. We take her to the medical room. Our counselors are there, the class teacher is there. We talk to the child, we make her comfortable, we tell her what it is and not to worry about it. And then if she wants to go back home, then we call the mother, or she can stay at school also. Most of the time we sort it out and they remain in school, because they understand maybe for 1 or 2 periods she's in the medical room, or because we have all the sanitary products in the school. For the EWS students, we give it free to them, and for others it's a very nominal price that they have to pay. We already have it in stock, and if there is a requirement for change in uniform, that also we provide. We have spare sets of uniform which we give to the children if it is required. That's how we manage, ma'am. Thank you.
That's great. Actually, it is very like reassuring. But I just hope that government schools should also have such a congenial environment. Coming to Vijay Lakshmi, you are most impressive person, and thank you for joining us. So, from your perspective as a biology teacher, you are a biology teacher. I think that is what is your subject, and coordinator of program for children. How is menstrual hygiene typically introduced and discussed in your own setup, SNS? So just let us know.
Thank you, ma'am. Thank you, everyone. I am very privileged to be here, and I will talk to you in Hindi.
हाँ बिल्कुल बिल्कुल
यस मैम, जैसे कि आप लोगों को पता है, ऑलरेडी इंट्रोड्यूस किया हुआ है कि सिंस 2016 हमारा स्टैंड एंड स्ट्राइड द्वारका में है, और धीरे धीरे 5 सेंटर्स हमने स्टार्ट कर लिए हैं। लोग आते गए और बच्चों की संख्या बढ़ती गई। तो स्टार्टिंग में तो अंडर प्रिविलेज्ड के एजुकेशन के रिगार्डिंग ही हमने स्टार्ट किया था, लेकिन जैसे जैसे मैं खुद क्लास लेती हूँ 9, 10, 11th वाले जो भी बच्चे हैं, क्योंकि मेरा बैकग्राउंड, मैंने एमएससी किया हुआ है, मैंने नोटिस किया कि बच्चे क्लास में कंफर्टेबल नहीं है। बात पीछे उन्हें बहाना हो जाता है छुट्टी करने का कि जब मैं पर्सनली पूछती हूँ कि क्या इश्यूज है, तो क्रैम्प आ रहे हैं, पेट में दर्द है, स्कूल में छुट्टी है, तो इस तरीके के इश्यूज आते हैं। तो मेरे दिमाग में काम किया है कि पैरेलल में हेल्थ का भी पार्ट बहुत उतना ही इम्पोर्टेंट है जितना कि हम एजुकेशन को फोकस कर रहे हैं। तो उसके बाद से हमने जो भी चेकअप कैंप लगाए या आई चेकअप किया, जिस भी लेवल पर, पहले फर्स्ट राउंड अपने लेवल पे किया सारे सेंटर्स पे, डॉक्टर्स को बुला करके फिर उसके बाद जिनको पर्टिकुलर कोई इश्यूज थे वहां पर ले जा करके हमारी कोऑर्डिनेटर के हेल्प से सारे सेंटर्स पर से हमने बच्चों को भेजा। डेंटल चेकअप के लिए भी डॉक्टर्स को बुला करके उसको फॉलो अप करते रहते हैं। तो सेम ये जो टॉपिक जो हम लोग का चल रहा है मेंस्ट्रुएशन हाइजीन डे का, जो मुझे लगता है कि बच्चियां काफी अवेयर हैं क्योंकि ऑलरेडी स्कूल में बताया जा रहा है उन्हें टाइम टू टाइम। लेकिन मदर्स अवेयर नहीं है बिल्कुल भी, और वो क्योंकि अंडर प्रिविलेज्ड है, मोस्टली मेड की कैटेगरी में है। राधिका मैम थी हमारे सेंटर पर जब पहला हमारा वो था, तो मदर्स क्या कर रही है, रोड चेंज करके घूम के निकल जा रही है क्योंकि उनका शाम का टाइम है, इवनिंग टाइम है मेड के काम का। उनको इतना वैल्यू नहीं समझ में आ रहा है कि इतना अवेयरनेस किस लिए किया जा रहा है, डॉक्टर्स की टीम किस लिए आई है, इनकी वैल्यू नहीं है। अपने एंड से हम लोग उसको पैड डिस्ट्रीब्यूशन विथ नॉलेज वो सारी कोशिश करते हैं। इवन डॉक्टर को मैंने गायनी के डॉक्टर को भी बुलाया है, 5-6 साल पहले भी किया था। तो उसको लैपटॉप पे पूरा पीपीटी के माध्यम से स्टोरी के माध्यम से बच्चों को दिखाना समझाना। और जो सबसे बड़ा इशू मुझे लगता है कि लैक ऑफ अवेयरनेस बहुत ज्यादा है। इवन स्कूल्स में टेबलेट आयरन की दी भी जाती है बच्चियों को और गाइड भी किया जाता है, लेकिन प्रॉपर गाइडलाइंस नहीं है कि उसे कब लेना है। और यदि ले भी रहे हैं तो उसका इनटेक मतलब प्रॉपर बॉडी में जा भी रहा है कि नहीं, एब्जॉर्प्शन है कि नहीं। उसके बाद वो नॉलेज नहीं है तो उसके साथ वो चाय ले लेंगी या कुछ भी, तो वो आयरन का लेना नहीं लेना बराबर है। तो ये सारी चीजें बहुत डेप्थ में हमने अपने आंखों से देखी है। हाइजीन का भी इशू है। इश्यूज तो बहुत सारे हैं, बहुत हमारे ऐसे लोगों की रिक्वायरमेंट है, और आईएपी की टीम हमारे साथ है तो बहुत ब्लेस्ड फील कर रही हूँ मैं, क्योंकि इनके साथ हमने एनीमिया डे सेलिब्रेट किया। तो बच्चियों में उनकी मदर्स में एनीमिया का बहुत सारा इश्यूज है, क्योंकि डाइट का बहुत बड़ा रोल है, जैसा भी डॉक्टर्स ने बताया अभी। डॉक्टर राधिका मैम भी बता रही थी कि उसमें अ, बहुत बड़ा रोल है आपको डाइट का। तो वो चीजें इनका इन्हें बिल्कुल भी गाइडलाइंस नहीं है। मुझे लगता है कि कोई एक प्लेटफॉर्म ऐसा हो जहां उनको कंपलसरी किया जाए कि आपको आना बहुत जरूरी है, आपको कुछ लालच दिखा के कि आपको ये चीज मिलेगा, तभी वो एक दिन का अपना ड्रॉप आउट कर सकती हैं अपने काम को, कि इसको इम्पोर्टेंस दे, इसको समझे। और मदर्स यदि समझ ले तो पूरी फैमिली और पूरी सोसाइटी जहां हम करना चाह रहे हैं वहां तक हमारी बात पहुंच पाएगी। एक साथ 5-5 फैमिलीज रहती है, एक टॉयलेट रहता है, तो हाइजीन का क्या लेवल होगा ये हम सभी लोग समझ सकते हैं। तो एफर्ट तो बहुत अच्छा है, और हम लोग एसएनएस की पूरी टीम इस पर बहुत काम कर रहे हैं एजुकेशन के साथ में। तो थैंक यू मैम, ओवर टू यू।
Okay. So, now do you provide these sanitary pad in your place?
यस मैम, वी आर प्रोवाइडिंग बट नॉट इन कंसिस्टेंसी। मतलब मुझे चाहिए ये और भी ज्यादा है कि हम उसे हर मंथ प्रोवाइड करा पाए, क्योंकि स्कूल की बच्चियों तक तो मिलता है, उनकी मदर्स, उनकी फैमिली, उनकी बड़ी सिस्टर, जो भी घर में फैमिली मेंबर्स हैं, वहां तक रीच नहीं है। और वो हमारे पास अप्रोप्रिएट है नहीं प्रॉपर वे में कि हम उन्हें हर मंथ दे पाए। उनकी रिक्वायरमेंट तो बहुत ज्यादा है, क्योंकि इतना स्पेस भी नहीं है कि उतने अच्छे से वो अपनी चीजों को धूप में सुखा भी पाए, वो भी नहीं है उसका जगह, जो इतना कंजस्टेड होता है ना। तो हमारे एंड से बहुत ज्यादा रिक्वायरमेंट है, पॉवर्टी लेवल बहुत ज्यादा है।
Okay. So, next question goes to Anjali Agrawal. So, can you, what are the actually basic rights regarding the menstruation and how internationally it's being perceived? Uh, Madhu, sorry, Anjali. Hello, Anjali. Anjali.
अंजलि आप अनम्यूट कर लीजिए।
Uh-huh. Hello. Hello, everyone, for inviting me here. And I just want to add that every human being, uh, menstruation is not a women issue, it is a human issue. अभी तक इसके मेंसुरेशन के अराउंड बहुत ज्यादा चुप्पी रही। किसी ने इस बारे में फीमेल्स को हमेशा ये बताया गया कि इसके बारे में बात नहीं करनी है, इसको छुपाना है, आज हम शहरों में भी अगर आज भी पैड्स खरीद के लाते हैं तो ब्लैक पॉलिथीन या न्यूज़पेपर में लपेट के लाते हैं। तो हमें समझना होगा कि इसमें कोई शर्म की बात नहीं है, और हमें बच्चियों को एम्पावर करना होगा, क्योंकि अगर मेंस्ट्रुएशन से ही उनको माँ बनने का, या उसी की वजह से ही पापाज और ब्रदर्स पैदा होते हैं, तो हमें इस बारे में खुल के इस टॉपिक को नॉर्मलाइज करना होगा फैमिलीज में और सब में। और जैसे हर ह्यूमन राइट्स होते हैं, ऐसे ही ये मेंस्ट्रुएशन भी ह्यूमन राइट, फीमेल्स के राइट की बात है। और जो फीमेल्स हैं, उनको पीरियड्स के समय पे काफी ज्यादा उनको उनकी हेल्थ, फिजिकल हेल्थ और मेंटल लाइफ और उनको डिग्निटी की बहुत जरूरत है, उसको हमें सपोर्ट करना चाहिए। This is what I have to say.
Who is doing actually on this regard? Your organization, how it works on this regard?
Ma'am, actually, see, Gunj is making the cotton cloth napkins, which are made out of soft cotton cloth. They are properly washed, they are machine washed and sun dried, then they are ironed, they are checked for any kind of buttons or metal pieces. Because our target is basically rural and tribal girls. They don't have access to clothes to wear, so how can they get the pads there? So we go there and discuss with them, try to know what problems they are facing, and they talk openly about the problems they are facing, and we try to tell them how to use the pads. They also have a right to sanitize life. And Gunj is making sanitary pad for the village girls, and it is totally biodegradable and reusable.
Okay. So actually now coming to Dr. Naina Dave, who is psychologist. So welcome, Naina. Hello.
Yeah.
Hello. Hi,
Thank you,
Naina.
ma'am. Thank you.
Okay.
Hi.
So I'm giving you a recent experience of mine. I met one of my patient. We operated. Patient was very complicated, obstructed TAPVC was operated when she was approximately a week old, and then she was always chirpy whenever she came back to me for the routine examination. This time she is coming after 3 years, and she started on her menstruation also. She is only 10 years old. But she was so sad. She was not responding to a smile. I keep on joking with my children. So, not responding at all. Uh, she said, and the aunt was with the girl, and she said, yes, doctor, your observations are absolutely right, because she was always a very good, happy child, but right now she is not. So, just tell me how to approach this child.
Okay. So it seems like she's experiencing certain changes in her body as well as in her mind surrounding her menstruation. And this is what we commonly call as premenstrual syndrome. So, premenstrual syndrome can manifest across any age. It can happen in a 10-year-old, or it can happen in a 30-year-old, or a 20-year-old. So, it manifests as, changes in mood surrounding the menstrual cycle, where the child could be irritated, the child may experience sadness, the child may also have crying spells, and may also be very sensitive to the comments of the teachers or the family members that she may otherwise not be. So it seems like she's experiencing premenstrual syndrome. So she has to reach out to a counselor or a therapist to deal with these critical changes, because because we usually acknowledge the changes that are happening in our body in terms of growth, in terms of hormonal change, but there are similar changes that are happening in our mind. There is a lot of impact of menstruation on our self-esteem, on our self-worth, which usually is not very evident physically, but it happens behind the curtain. So, in such cases, it's always best to bring the child to a counselor, and a counselor or a psychologist or a therapist, however we may call them, are trained to help the child navigate through these delicate times, so that the child does not develop a very negative view about menstruation or these body changes, also about themselves.
Thank you, Naina. Coming back to now, this is most important thing about whatever is happening is somehow related to one system, that is the so rural area is the endocrinal system. And now, Dr. Swati Kanodia, please let us know if there is no menstruation happening in particular 10-year, 11-year, when other girls are menstruating, how would you actually approach to this child?
Good afternoon, everyone, and thank you, Smita ma'am and Dr. Radhika, for including me and connecting with so many dignitaries about this very important topic. So, menstruation no-show. So, basically, what you will call in clinical terms as a primary amenorrhea when there are no periods. So, actually, we start thinking about it only if a girl has had no periods till 15 years of age with breast development in hair and everything, or there has been 3 years since the body changes have started, but there has been no period, or if till 13 years of age there is no show of any other body changes, then only we would start thinking about is there any issue why the periods are not happening. Actually, these days the girls have started menstruating very early, actually, than what they used to do previously. So the paradigm has shifted, actually. And as Dr. Radhika had mentioned, a lot of things, the systemic disorders which can affect periods. Similarly, the same systemic disorders can actually affect having no periods also. So that is why if any girl comes to us who is about 14, 15, who has not had periods yet, so it is very important that few common things are ruled out. Usually the common things only, most common is the constitutional delay, that it is just that the system is moving slowly and they might have periods late with no problems at all. Or if there is any chronic disease that the child is suffering from because of which the periods are delayed, or if there is any endocrinal issues, as she had mentioned about hypothyroidism, which is most common, which can affect having periods if it is not well controlled, or if there is any CNS issues in terms of the hypothalamus or pituitary being affected, or if the organs, genital organs which are responsible for periods, that is ovaries and uterus, if they are affected. So these things need to be ruled out, and also the lifestyle has to be ruled out, because if they have any eating disorders, then they can have do not have periods. And if they have obesity, usually obese children we do see early periods. They have period problems later on, but we usually see early periods because of overnutrition. So these are some of the things that we need to rule out in a child when we are approaching them not having periods till 14, 15 years of age.
So, Dr. Swati, what I gather that it should be 3 years from the onset of the other secondary characters. And
Yes.
the thing is, 13 years you said probably. I like Dr. Vijay Lakshmi, me and Radhika, we just met one girl. She is very active child and very brilliant child, 14 years old. And there was no show of menstruation. Family is little bothered. Then we asked that, okay, what about the mother? So mother said, yeah, I got my periods around say 14 years or so. We consoled the family. But according to you now, 14 years, no show of menstruation. Should we advise that girl to go for some kind of investigation?
But if there are no secondary sexual characters also in that girl, then definitely we need to do check for the hormone levels. We need to check for thyroid levels to see if there is any cause which is not allowing the secondary sexual characters to come in for the periods to start. But if the secondary sexual characters are there, then we do counsel them to wait for some more time and improve the nutrition of the child. And if the child is strenuously exercising, sometimes it can happen because of that also. So we need to just modify the lifestyle and wait and watch if secondary sexual characters are there.
Thank you so much, Dr. Swati. Tulika, do you think menstrual education should begin earlier than it currently does in schools? Why or why not?
Namaskar, ma'am. Yes, ma'am. Nowadays, as
Please be a little louder. I'm not
yes,
able
ma'am.
to hear.
Can you hear
Ah,
me?
yeah.
Okay. Ma'am, today, nowadays, we are looking at and we see that many girls are starting their puberty very early than in previous generations. जैसे अपने यहाँ 13, 14, 15 होता था. But nowadays, some very young girls, 8, 9, they're reaching puberty. So I think if menstrual education starts early, not like in full-fledged, but if we can start a gradual way of making them understand as to what they are going through, what their body is going through, so that they are not scared or unprepared or confused. So because it's not a one-time thing we dump on a child and say कि ये है, मतलब it is a gradual, very evolving conversation we need to have with the child. So any kind of, like, if the teacher, if the caregiver, if the mother, if she can have a more like age appropriate, because 8, 9, they are still very young. But but if we can have a conversation with the child in a very open way, then we save the child from any kind of embarrassment or shame. That's what I think.
Thank you so much, Tulika. Madam Leena, what is the menorrhagia, dysmenorrhea? When to bother these cases? What should be our approach? This is very broad topic, and you have to be very comprehensive. And you are the
Yes.
only one who can do it.
Thank you, Dr. Smita. I think 70% of our OPD, covers these kind of problems that patients come from, and it is at all ages, and whether they are young or they are middle age or the reproductive age. Menorrhagia and dysmenorrhea are so very common. Coming first to dysmenorrhea, I heard one of the speakers talk about missing school in young children because of the period cramps, and it's almost like the done thing when you come to hear that okay, she's not going to school because she's having pain and it's her time for her periods. So I just want that they should be told, they should be made to understand that it's very common to have a premenstrual cramps, and the idea is not to skip school or to sit in one corner, but it is because of a chemical called prostaglandin which gets released and which causes this period cramps. And most of the time, all it is requires it for a woman to be a little more active. In fact, there are few one or two yoga maneuvers that I tell them to do, which is very simple: touching the toes or turning your hands side to side, so that you are actually giving a kind of pressure to the pelvis, and that
Yeah,
leads
वो भी है
to the pelvic
आज लास्ट
congestion
है
getting
आज खत्म हो रहा है
released, and the dysmenorrhea goes away. That is a simple thing that we tell them to do, and if that doesn't work, then a simple tablet of paracetamol can be taken, and that usually gets released as soon as the menstruation starts. What we tell them is that if it doesn't, and if it is happening in every month, or if it is affecting your lifestyle, if it is affecting, making you miss school or miss college or miss your place or workplace, or it is affecting your quality of lifestyle, then you must go and meet the doctor, because there can be some other problems which can cause dysmenorrhea, like we have endometriosis, then we have ovarian cysts that can sometimes cause dysmenorrhea. So this thing has to be told to them. By and large, a young girl who comes, say, at 16 or 17 to me, the first and foremost thing is to reassure them that this is absolutely normal. um, to let them know that it is all right to take a simple tablet of paracetamol and be fine. And maybe if it is happening again and again, then we may run a ultrasound of the abdomen to see that all is well. Coming to menorrhagia. Now, menorrhagia is abnormal menstrual bleeding. That is usually the menstrual cycle can be anywhere between 2 days to the maximum of 7 days. If it is more than 7 days, then the lady needs to get herself investigated. Or if it is just say for 4 or 5 days, but it is so heavy that there is clotting. So to make them understand, we have to ask them what is the pad count, how many pads you used every day, and also whether the menstrual blood is clotting, because normal menstrual blood should not be a clotty type of blood. Clotting means there's something wrong. So we can easily pick up those cases where we feel that there is something wrong, and then subsequently we can investigate them. We So we need to, every patient of menorrhagia, definitely we need to investigate. Most of the time in young people, what happens is menorrhagia is self-limiting, maybe 2 3 cycles, and then it sets its on the right course. But if it is happening again and again, say more than 2 or 3 cycles, then definitely we need to investigate, because starting from small endometrial polyps to fibroids to endometriosis, we can pick up these lesions very early and treat them and give them a lot of relief. So our approach has to be uh, uh, very pragmatic. It has to see the situation as it comes, the age group in which the girl or the woman presents to us, and to give them the appropriate investigations and of course the appropriate treatment. What is important in all such cases is to always look for anemia, because that is the most important factor that gets overlooked when we are treating these cases, because an anemic woman is likely to suffer, or an anemic child is likely to suffer the most when she suffers from menorrhagia.
Thank you so
Yeah.
much, Dr. Gina, making very simple. One more question is like clot during the menstruation and passing of passage of the clot. So, how much time should be given before seeking an investigation?
Yes. So if the men, like I said about a pad count, if a woman is saying that, her pad count is like, say, every hour, or like, the words that they say is, I feel as if the bleeding is happening like opening a tap. Or if she passes a clot, we mustn't forget that a fist, like a clot which is in the size of a fist, means 250 ml of blood which is gone in one go. That means that there is something wrong, because normal menstrual blood should not clot. That means there is something wrong. So if any woman has clotting, then she should go immediately. If a woman has flooding, that means feeling as if the tap is on, and she's just flooded and her pad is completely soaked and dripping within say an hour or two, then she needs to come. Or if the total pad count in a day is more than 5. So this is a very rough way of explaining to a patient and telling her when she should immediately go and seek some help. And of course, once she comes, then we start the investigations to find out why she is having this problem.
Thank you so much, Dr. Lina. Dr. Radhika, nutrition and supplementary feed in these adolescent girls during an with or without menstruation period involving. So, does it affect the premenstrual symptoms if one girl is deficient in diet or vitamins or something, or hemoglobin? So, does it affect the premenstrual symptoms?
Thank you, ma'am. Indian Academy of Pediatrics endorses a balanced diet. That is a balance between our carbohydrates, proteins, and fats. I'll not go into the numbers. Normally, 2100 to 2400 calories per day is advisable for an adolescent girl, and that should be a combination of all food groups. Most commonly in common language we say, I tell my patients, go food and grow food. So go food is the energy dense food, the carbohydrates, the fats, the sugars, wheat, rice, everything, millets. And the grow foods are protein rich diet and vitamins and minerals, that is pulses, green vegetables, nuts, etc. So this is basically about about the balanced diet, and we should start concentrate more on iron rich diet. Why iron? Because due to rapid growth and menstrual blood loss. So the sources are green leafy vegetables, jaggery, legumes, kala chana, drumstick. Even we can use a like iron utensil for making food, because some amount of iron will go that way also. And the government program is going on weekly iron and folic acid supplementation for all the girls, whether they are going to schools or not school. We should encourage that. Those girls who are not going to school, they get it through Anganwadi workers, and the iron content is usually 100 milligrams and the folic acid content is 500 micrograms. This is a blue color tablet. So we should always encourage the teachers to ask, and even the parents to ask, whether they are actually taking that weekly blue color tablet or not. Second is calcium and vitamin D. Why calcium? Because there is peak bone mass growth during this period. And if adequate calcium and vitamin D is not given to the adolescent girl, then she'll suffer from osteopenia later in life. So the sources of calcium are milk, curd, then fortified foods, sesame seeds. These seeds are in a lot of fashion these days. Then vitamin D, sunlight, fortified milk, egg yolk, and fatty fish. So the ideal guideline is calcium 500 to 1000 milligram per day. And for vitamin D, what I tell my patients is our requirement is around 600 to 1000 per day. So if we take one big dose of 60,000 units once in 2 months, that would suffice. Now comes the protein. Because of protein is required as there is a huge growth spurt. So the sources of protein are milk, pulses, legumes, meat, tofu, dairy products, egg, all these things. So we should encourage a balanced diet with enough of protein. The diet should not be deficient in proteins, and it should not be too much snacky with junk foods. The children tend to take very heavy snacks in form of high rich, salty products, chips and kurkure and all that. That should be discouraged. All packet food should be discouraged. And then folic acid and B12. Why do we require folic acid? For RBC growth, and vitamin B12 for neurological development. So the sources are folic acid are green leafy vegetables, citrus fruits, and lentils. And for B12, usually the animal sources. So it is seen that underprivileged girls, especially, and even the well-to-do girls who are vegetarian, who have a vegetarian diet, they have deficiency of B12. So that should be supplemented accordingly. Then comes zinc and magnesium. What is the purpose of zinc and magnesium? They support the immune system and they regulate our moods. So help even in the menstrual cramps. And the sources are nuts, whole grains, seeds, and dairy products. Next comes what the answer for PMS is omega 3 fatty acids. So, omega 3 fatty acids usually they elevate our mood, they increase the concentration span, and hence help in PMS. So, what are the sources of omega 3 acids? One, walnut. आजकल अखरोट सब लोग कोशिश करते हैं खाने की. Then flaxseed oil and fatty fish. So if flaxseed oil can also be taken in form of capsules, and even fish oil capsules are available. So my one take home thing is encourage homemade food, homemade tiffins with sufficient fruits and adequate hydration, and monitor for signs of eating disorders, anorexia, bulimia, and even obesity. And if it is there, we should consult a doctor or a nutritionist. And we should tell the girls not to skip any meals. Breakfast should be the heaviest meal. So, adequate balanced diet with all vitamins and minerals, lot of good hydration. That is what is required for an adolescent girl. Thank you, ma'am. I hope I have answered.
Hey, wonderful. Yeah, great answer, Dr. Radhika. And I think it is really important. Only one thing, can you tell me why children prefer junk food and eating outside? They will eat dal and roti outside in the restaurant, but will not eat at home. Why it is so?
I think, ma'am, it's taste buds, and we should, as parents, we should be a role model for them. If I eat outside, My son is also going to eat outside, which he does many times. But we should ourselves be a role model. And एक routine होना चाहिए, one breakfast, one lunch, one dinner, and 2 snacks. Once in a while we can go out and eat, but every day, every week, and those packet food, 10 rupee chips, kurkure, even low socioeconomic, it is seen that they will not buy a good product, they will not buy dahi, they will not buy paneer, but they'll
Please
prefer
mute
those
yourself.
biscuits. They'll prefer biscuit, पार्ले जी का पैकेट, and खाना ही initially पार्ले जी और दूध से start होता है. So we should start correcting it right from 6 months of age when these mothers come to us for complimentary feeding advice.
ओके, थैंक यू सो मच राधिका. मिठू मैम, प्लीज टेल अस, हमें बताइएगा कि फ्रॉम योर प्रोस्पेक्टिव एज ए बायोलॉजी टीचर, और आप प्रोग्राम भी कोऑर्डिनेट करते होंगे इनके लिए, तो मेंस्ट्रुअल हाइजीन को कैसे इंट्रोड्यूस करना है, कब करना है, और कैसे डिस्कस करना है एक स्कूल सेटिंग में, जिसमें डिफरेंट एज ग्रुप के डिफरेंट, मोस्ट इम्पोर्टेंट part is you are not having uniform population of students. They are coming from different backgrounds, different values. How do you do that?
Yes, ma'am. So first of all, we introduce this menstrual hygiene when the child is in class 4th, 5th. So about the age of 9 to 10 years old. So we only have a workshop for girls for class 4th and 5th, and it is not conducted by any doctor. It's the school council. It is their peers, students of 11th, 12th, and we have a Daitwa club also in our school. The students of that club also can go for this. They can interact with the kids, because when they see a teacher or a doctor, they sometimes are very apprehensive, and they will not feel free to ask questions if they have. And we don't directly go for menstruation. We will just tell them certain things that you feel, you can see some changes. When you're 9 years, 10 years, maybe you're growing tall, and maybe you're having, emotional outbursts. You get angry very soon. You throw things at each other. You cannot control your anger, or there is some pain in the lower part of your body. So it's in a very simple way that we try to introduce. And then probably when they're in 6th, 7th, then we have our teachers. Still we don't approve that they should interact directly with the doctors. The first workshop that we have is in the month of April, May, when we teachers and the student council help us to do the workshop with only the girls. Now when it comes to the boys, we take girls and boys together for a workshop and adolescent changes during adolescence. That is for the entire school or the students. Class wise we have it. So then we don't differentiate whether it should be only for the boys or for the girls. So the changes are discussed, what control these changes in a very simple term and terminology, is not going to the depth of it. Then once we are through with this workshop, then probably in the month of August, we have doctors coming from Fortis, and they interact with them. Once they are already aware of, that certain things will change, and these are the signs and symptoms that we should look for. And if it is such, then where should we go? Whom should we approach? Whether at home or in a marketplace or when you're in a mall, wherever you are. So there you need to, go to your parents or call up someone who can help you if you are outside. And in school, we are always there. And I've already told what all we can do for them in case there is an emergency. But then that workshop will, it will clarify everything. They don't have a doubt. The boys don't feel as if it is a, something that they should not talk about, that they should not interact with the person who's conducting the workshop. So they feel free to ask them, why is it so, So maybe the doctor will explain. That's a regular process, when there is no fertilization, or when there is the male and the female gametes probably they don't meet up. So that has to go out of the body. The body, does not keep anything that is of no use to us. And this we can see in animals also. When I saw them telling this, they were more careful, they were more alert. Okay, that's a very common thing that happens in all the mammals. So they thought maybe you have a pet. Even the pet will undergo if the pet is a she animal, and this is a very common thing, and it's a part and parcel of the women and the females, and you will have to take it as it comes. So
Thank you so much. Yeah.
thank you, ma'am.
Thank you so much. So next question goes to Vijay Lakshmi. What challenges do you face? Uh, just a minute. What challenges you face in the delivering the menstrual education to both girls and boys, and how do you address them? It's almost similar, actually, question as it was the previous one, but the only thing your set of the children are different from different background. So that is why I keep same question for you also.
Okay.
Vijay Lakshmi?
Yes, ma'am.
Yeah.
I think these chapters are in their syllabus, class 8th. I taught them very well. And main thing is boys also questions very frankly the as a chapter they don't know, मतलब उस तरीके से उतना माइंड में उसे कुछ भी होता नहीं है, तो बताने में भी हम लोग कंफर्टेबल फील होता है कि ये बॉडी का पार्ट है और हाइजीन का पार्ट है। जैसे आप ब्रश करते हो, जैसे मतलब नहाना धोना है, वैसे ही आपको पूरे बॉडी का केयर करना है। इस वे में मतलब दोनों गर्ल्स एंड बॉयज को हम लोग अच्छे तरीके से उसको एजुकेट कर पाते हैं। और ऐसी कोई दिक्कत मेरे हिसाब से तो नहीं है, लेकिन फिर भी जो स्कूल्स का मैंने ये देखा हुआ है कि टाइम से पहले ही जो मैंने अपने बच्चों में देखा, अपनी बेटी के उसमें, कि जब तक मुझे बताने की जरूरत पड़ती उसे बहुत कुछ मालूम करा दिया गया था स्कूल में ऑलरेडी। तो बहुत ज्यादा ऐसी चैलेंज नहीं फेस की मैंने। और अंडर प्रिविलेज बच्चों में भी, क्यों जो स्कूल गोइंग बच्चे हैं उनके साथ ऐसा बहुत बड़ा इश्यूज नहीं है कि उनको समझाना इतना ज्यादा डिफिकल्ट हो रहा है। हाँ, लेकिन गुड टच बैड टच ये चीजें समझाना बहुत मायने रखता है, जो टाइम टू टाइम हम लोग उसको ओवरऑल होलिस्टिक हेल्थ के रिगार्डिंग होलिस्टिक अप्रोच होता है वो हम उससे गाइड करते हैं। Thank you, ma'am.
So, Vijay Lakshmi, the issue is one also that children, if you are telling them little prematurely about their upcoming sexual changes, so they are very inquisitive. So sometimes it may actually lead to some deviant behavior also. That is one. I will ask this from our psychologist actually. So coming to Anjali, what are the situations leading to poor management of menstruation? Anjali? Anjali, please unmute yourself.
Yes, ma'am. Ma'am, actually, because we are dealing with children in the tribes and villages, we have seen situations in which there are 8 ladies in the house and they don't have clothes to wear, and whatever anything that absorbs, like they're using leaves, ashes, and if there is one piece of cloth, all the ladies in the family are using the same cloth. So the girls in their childbearing age of say 15 or 16, they spoil their uterus because of tetanus and different problems. So because they're not talking on it, they don't have facilities. We usually organize Chuppi Todo Baithaks and we sit closely with the girls and females and talk to them what issues they are facing. We make them confident. We try to give them confidence that there is nothing to hide or there is nothing to like face spoiling your health because of this. We train them how they can lead a like they don't have washrooms. One more problem they are facing is they usually take bath in the rivers and ponds and they don't have changing rooms. So we have one more project, Cloth for Work, in which these ladies they work on their problems and they get the things of their use. So in that Cloth for Work project, they make bathrooms or changing rooms near the ghat, and also they grow vegetables, green vegetables in the kitchen garden, in the open area, in the fields, so that the nutrition part is also fulfilled. So basically, all the issues which the females, basically in villages and tribes also, the females, they are taking care of their male family members and ignoring themselves. So we just make them understand कि अगर वो उनकी हेल्थ अच्छी नहीं होगी तो how can they take care of the other family members, and they have a very important role to play. So actually, it's very interesting, Anjali. My daughter was working with Kailash Satyarthi Foundation in class 12th. So there were children, they were not having the girls in that ashram over near the Jaipur. So those village girls used to come, and she was going into their classes, and then she told me that they are using even cow dung. Yes, ma'am, we have also. It was really surprising to me, actually. Right. Ma'am, we have also met few girls. They're using cow dung and the ashes from the chula and anything that absorbs. बट दैट इज वाई मैम हम हमारा जो गूंज का जो मोटिव है वो उनको ऐसे पैड्स प्रोवाइड करना नहीं है, एक तो एक सस्टेनेबल सोल्यूशन चाहिए, तो उसके लिए वो कॉटन के जो पैड्स बना रहे हैं, कॉटन के कपड़े के, दे आर मेकिंग सैनिटरी पैड आउट ऑफ द कॉटन क्लॉथ विच वी गेट like old dhotis and purani chadar and soft material, and they're also making huge panties for the girls and ladies out of the t-shirt cotton t-shirt material, and they are telling them, they're training them how to use it and how to dispose it after reusing it after several times, and tell them to dry it in sunlight so that it doesn't have any it does not spread any disease. कोई भी कीटाणु उसमें रहना नहीं चाहिए, वेट नहीं होना चाहिए और क्लीन होना चाहिए. इट शुड बी वॉश प्रॉपर्ली विद सोप एंड आफ्टर दैट विद वाटर. Thank you so much. Thank you. Yeah, thank you. So, in your experience, how well prepared are men, particularly teachers in society, to respect menstruation as a physiological consequence of maturity? That is one. And the second part is when we are giving these kind of education. So, so how actually sexual behavior changes amongst the boys and girls? Well, because you know our age for the age for the sexual intercourse is actually 18 years. So how the things will culminate when knowledge is coming early and curiosity is the main kind of behavior of the children and the adolescent? Dr. Aga? Hello? Nana?
Nana?
Nana? Nana? She's probably muted, I think.
Yeah, am I audible? Yeah, am I audible?
Yes,
Yeah,
yes,
yeah,
you're
now
audible.
yeah.
Am I audible now?
Yeah.
Yeah. So, well, this is a very, very important question, and thank you for including this question in this discussion. So, coming to the first part of the question regarding how well prepared are the male teachers, so I would there is no definite answer to that. In my entire clinical practice, I have seen both the scenarios. I have seen teachers, male teachers from government schools, who are extremely sensitive towards these changes that are happening in
Satya,
India female
roti Satya.
students. Whenever we go for these camps for assessment
Please
of
mute yourself, the people who are
அந்த
not
கறியும்
talking.
தயிரும்
Please mute yourself.
சரியா வேணா
Okay.
வேணா அதுல
Continue.
இந்த சியா சீட்ஸ் போடுறேன் அந்த தயில
Radhika,
protein
okay. Okay, continue, Nana. Yeah. Nana, please continue.
this particular student has been having anger.
Can you be a little louder? You're not audible.
I think connectivity is issue.
And this particular student has has been undergoing some emotional issues or is having some changes. On the contrary, instances where the student
नैना आप म्यूट हो गए हो.
नेटवर्क इशू लग रहा है वो. नेट इज स्ट्रांग हो रही है.
Should we go to next question and come Naina subsequently? Please call her on phone, Radhika.
हाँ जी मैम.
Okay. Or Puneet can call, whatever. So, what is PCOD and why it is included now in lifestyle diseases? Dr. Swati Kanwati.
Yes, ma'am. So now basically we have been talking so much about menstruation and hygiene and everything. Now after the girls they start with their periods. Now these days we have been seeing a lot of girls who present with symptoms of PCOD quite early. Like we are seeing 12, 13-year-olds who are having issues. So PCOD basically is a spectrum of disorder which includes irregular periods, increased facial hair, and acne. So it's not important that all the girls will have all the symptoms. They can have either, they can sometimes present only with irregular periods, sometimes their periods are irregular but they have a lot of facial hair, they have a lot of acne. So it can be a variety of presentations that they can have which all come under the spectrum of PCOD. And usually क्या होता है कि सिर्फ एक अल्ट्रासाउंड करा लेते हैं और उसमें बल्कि ओवरीज आ जाती हैं एंड दे से कि जी आपको तो PCOD है. But it is very important to know that the bulky ovaries can be a normal phenomenon in any girl up to 16 years of age. So that is not the criteria to label them as PCOD and start them on medication. So that is why it is very important that PCOD diagnosis is made based on clinical features, blood investigations, and ultrasound. Before that, they should not be labeled as PCOD. Other thing is that now why it is included in lifestyle diseases, because these days we are facing a lot of obesity in kids because of their lifestyle changes, overnutrition, lack of exercise. A lot of girls are presenting to us with increased body weight. Now we all know that because of overnutrition their insulin levels increase, which causes insulin resistance in them, and these high insulin levels lead to more production of male hormones. PCOD is basically an imbalance between your male and female hormones. Your male hormones increase, because of which you start having these features. So because of insulin resistance the male hormones increase, and then we have features of PCOD. So it is basically like a vicious cycle. आपको एक चीज सिर्फ पर्टिकुलर आप चेंज नहीं कर सकते हो, आप लाइफस्टाइल चेंज करोगे उससे आपका इंसुलिन रेजिस्टेंस कम होगा, उससे आपके मेल हार्मोन्स कम होंगे, उससे आपके जो है पीसीओडी के फीचर्स ट्रीट होंगे. सो इट हैज टू बी अ होलिस्टिक अप्रोच दैट हैज टू बी टेकन. Not only by one investigation we can diagnose a PCOD and start treating them with some hormones or something like that. So that is why it is very very important that lifestyle changes are basically included in treatment of PCOD if a child or girl is diagnosed with it.
So, Swati, the PCOD, I used to think that it's a congenital kind of thing where the enzyme is deficient. So, you think that is not there? This is primarily imbalance. It's not the lack of enzyme at particular pathway. Because PCOD can be two types. One is like you have androgen dominating and the estrogen dominating. So, those kind of thing.
No, ma'am, it is not congenital. It is not congenital, and it is also very important to know that only obese girls do not get PCOD. We have a lot of thin girls also who have PCOD. So it's
Can I say
basically.
something, Dr. Swati?
Yes, ma'am, please.
We are seeing a lot of lean PCOS coming, and in fact, they do worstly off in medication, especially when we come to fertility practices later on. So lean
Yes, ma'am.
PCOS is now very much an established variety of PCOS, and we really need to work on that, because lots of patients they think they are not PCOS because they seem to be having a normal or even a lower BMI.
Exactly. That is what the thing is, that because they think that they cannot have PCOD just because they're not overweight. This is something that needs to be looked into. That is, ma'am has said very correctly.
Okay, thank you so much. So, Tulika, how authors and publishers may actually help us in the creating awareness amongst the masses? Like, I'm not talking about Delhi. I was very pleasantly surprised that in this program SNS, which we did for 5 days, almost mothers were quite efficient and were ready to interact with the girls of pre-menstrual age to inform them and all those things. So those are the very idealistic situation. I don't think everywhere in India this idealistic situation is present.
यस मैम, यस मैम, इंडिया में अभी भी मेंस्ट्रुएशन के अराउंड जो कॉन्वर्सेशन है, स्टिल इट इज नॉट दैट ओपन, but like as an author community and people who are working in spreading the knowledge and contributing to that aspect, if you have heard about a comic book called Menstrupedia. So it's a wonderfully created comic book in which, like, from early puberty to how to what are the signs when you are menstruating, when you have any period pains, and even for the boys they have created a beautiful comic. And I have one of my books called When I Grow Up, which I have created to address the same aspect, but this is more for boys and girls. So as ma'am, as I have two boys, and from very beginning I have made sure that they understand what periods are, because they should not come as, because many times when जब हम छोटे थे तो कभी कभी बस में we used to hear the boys used to say अरे ये girl problem है, it's a girl problem. So तो उस शुरू से ही मुझे ये था कि जब अगर मेरे साथ कभी ऐसा होगा तो ईश्वर की कृपा है या लकी अनलकी, uh, I always wanted a girl, but I have two boys. And I have taught them. जब वो उस एज पे आए ना, तो I picked up my example and tried to explain that कि ये पूरा if you look at the nature से शुरू किया कि ये nature जो है आप देखोगे एक साइकिल में चलता है. मंथ्स आते हैं, फिर सीजन्स बदलते हैं, साल बदलते हैं, फिर वो वापस आ जाते हैं. आप आम खाते हो, फिर वो आम आना बंद हो जाते हैं, कुछ समय बाद फिर वो आम आ जाते हैं. आप विंटर्स में देखो ये सब्जियां मिलती हैं, तो आप देखोगे कि पूरा नेचर जो है, ये पूरा बायोलॉजिकल प्रोसेस जो है एक एक साइकिल में चलता है. और ये साइकिल जो है एक मेल एंड फीमेल्स दे बोथ गो थ्रू, बट विमेन को भगवान ने ऐसा बनाया है कि वो जो है वो क्रिएशन में पार्टिसिपेट करती हैं एंड दे आर द लाइफ गिवर्स. तो उनके लिए ये ऐसी चीजें होती हैं. और जब आपके साथ ये हो रहा है कि आपके आपकी आवाज बदल रही है, आपके हेयर्स ग्रो कर रहे हैं, आपको पिंपल्स आ रहे हैं, तो ये सारी चीजें विमेन में भी हो रही हैं. वो भी कंफ्यूज्ड है, उनके साथ भी हो रहा है. तो ऐसा नहीं है कि आप बॉयज हो तो आपके साथ ही हो रहा है. तो दैट वे, मोर लाइक अ ओपन काइंड ऑफ कॉन्वर्सेशन आई हैव ट्राइड टू पुट इट इन माय बुक ऑल्सो, जो मैं लिख रही हूँ व्हेन आई ग्रो अप. एंड दूसरा कि उनको हमेशा ये समझाया गया है कि जब आप कभी कभी आप ऐसा फेस करो कि आपके क्लास में या आपके बस में कोई लड़की है जिसको कोई इस तरह की प्रॉब्लम है, तो यू डोंट हैव टू गिगल एंड यू डोंट हैव टू लाइक हश हश. आई मीन, यू ट्राई टू help her. You can ask if she needs any kind of help. So you have to show empathy, बिकॉज वो भी, उसके लिए भी ये सारी चीजें नई है. और दूसरी एक अगर नॉलेज गिविंग कम्युनिटी की तरफ से, तो वन ऑफ माय फ्रेंड, शी हैज डेवलप्ड माय फर्स्ट पीरियड किट. सो इट्स अ वेरी ब्यूटिफुल छोटा सा बॉक्स टाइप का है, विच हैज अ पैड एंड अ स्मॉल बुकलेट, कुछ न्यूट्रिशन बार है एंड एक पॉजिटिव मैसेज है. So, I think they have started working in many government school to make the first period look less scary. और सिटी वाइड कैंपेन भी चला रहे हैं। और इस तरह की बहुत सारी छोटी छोटी चीजें हैं मैम। और अभी हाल में आई वॉज इन्वाइटेड टू वन ऑफ द स्कूल्स, एंड वहां पे हमने देखा कि इसको इन लोगों ने एक जिसको बोलते हैं स्ट्रीट प्ले की तरह से दिखाया है। और वो एक मिथ ब्रेकिंग को करके, जैसे उन्होंने एग्जाम्पल लिया था कि किस तरह से साउथ इंडियन कम्युनिटीज में जो गर्ल है उसका जो फर्स्ट पीरियड उसको एक सेलिब्रेशन की तरह लिया जाता है। ये नहीं है कि ये कोई प्रॉब्लम है, ये समथिंग टू लुक फॉरवर्ड टू। अब तुम यू आर रेडी टू गिव लाइफ टू समबडी। तो एक तरह से इसको ऋतु काल संस्कार कहा जाता था। तो वहां पे बड़ा रिचुअल के साथ जिस तरह से शादियां होती हैं उस तरह से उन लोगों ने उसको पूरा स्ट्रेट प्ले को बड़ा अच्छे से वो किया था कि कैसे जो पीरियड है इट कैन ऑल्सो बी अ सेलिब्रेशन रादर देन अ गर्ल प्रॉब्लम। सो रिप्लेसिंग एनी काइंड ऑफ जो जिसको हम हश हश कहते हैं, उसको एक अवेयरनेस से, अगर हम उस गॉसिप को, अगर हम एक गाइडेंस से, और शेम को अगर हम साइंस और सेलिब्रेशन से कनेक्ट करें, तो हम एक अच्छी राह दिखा सकते हैं अपने आने वाली पीढ़ियों को। तो बहुत बहुत धन्यवाद। थैंक यू सब, थैंक यू सभी।
Very well said, Tulika. Thank you so much. So, a little bit time I am taking because my it's fine. Dr. Lina, over to you. And we will go a little faster now. What are the examples of social inclusion of menstruation as a milestone in Indian culture? Can you remember anything? And should menstrual hygiene lesson or the communication include sex education in the adolescent girl?
Okay, the first part of the question, I think to some extent has already been answered. There are two places. One is in the south where we hear about, the first period being a celebration. So that actually is almost like a landmark. It's like celebrating to the extent of, like you celebrate a wedding or you celebrate a grand birthday. So that is done, and the person is made to feel special instead of feeling uh, you know, to be felt to feel as if there's something wrong or to feel shame or feeling embarrassed. So that is one. Even in many of some of the tribes in India, like the Khasi, tribes in Northeast, there also it is a celebration. So I think these two are the examples. But in most of the other areas, generally it is. A person is informed that now you have to be careful. All kinds of restrictions are brought in. She's not allowed to enter into the kitchen. She's not allowed to sit with the rest of the family members. She's made to feel, the she's socially excluded from all regular activities, like all, especially religious activities, or even in some places, even to the extent of not being allowed to take a bath. So I think it's very gratifying that in some of the societies this has been considered as a big event, and and that's how it should be, because that is basically giving the signal that all is well, and you're celebrating something. You're basically celebrating the onset of womanhood. And
Dr. Neena, I just want to put a question over there. Should we call Archie's and creating card for the first menstrual day?
why
Because
not? I think wonderful. I think it should be there. It's like if it is a
commercial angle and
celebration,
popularizing the concept.
yeah. If we are celebrating something and we are giving the very positive approach to it, it's really something. I think families have to understand that if it is a celebration, it's like a birthday. So why not a birthday a card to celebrate that? I think that is a very nice thing. And when you said about should the menstrual hygiene lessons or communication include sex education in adult circles, very, very, very important. In fact, you'll be surprised that a lot of young girls are being brought in by their mothers, to the gynecologist, especially those who have typical symptoms of dysmenorrhea, and they discuss. And the first thing I have to ask them is their menarche. At what time did they first start menstruating? And we generally find it is 1 or 2 years back. And somewhere during the conversation, they make it clear that they would like to talk to us alone. So you would be very surprised to know that when I send have to request their moms to leave my chamber, uh, out tumble so many questions that these girls want to ask us. And it is so very clear that they haven't had access to um, correct sex education information from whatever other sources they've been able to, which of course start from home or maybe starting from their peers or maybe even in schools. So we are getting a lot of such young girls who would rather come and hear it from a gynecologist. And I think we have a very important role because we've got to give them absolutely factual information, and we have to be we do not have to be judgmental, and we also have to let them know about contraception and how to protect themselves. And apart from, of course, menstrual hygiene, we really have to give them sex education at a very early age these days. So I would like to tell even other gynecologists or even others that whenever such a girl comes to you, do take out time where you can independently, or uh, you're able to talk to her without the presence of other elders, because they may find it difficult to talk about these things. But as far as possible, impart the right kind of sex education to them. And I do feel that this kind of sex education, it should start now at a much earlier age than what it is being talked about now. Say even in schools, etc. In other places also should be talked at a much younger age. Like you have started talking about menstrual hygiene, like someone said in class 5. I think even sex education should be started at a very early age.
So thank you so much, Dr. Lina. Actually, what I was asking laughingly, but I seriously believe, like in South, they are marking it with a great celebration. Probably we need to. We are actually by nature, by culture, we are celebration societies, and we should definitely like God Bharai. Pregnancy in particular period, you go for a God Bharai. That kind of something should happen for the first menstruation period also. There should be gifting item for that also, maybe card made for that also. And I think that will be acceptance like a normal thing. That will be a great idea. Thank you so much for
Us,
telling.
like you mentioned about the card, I feel a celebration means gifts also. So the girl starts feeling special instead of feeling right from the beginning that something is wrong with her.
Yeah.
Yeah,
So that special feeling and feeling of the belonging should be there when you have some new thing. First thing happens like you feel isolated.
yeah,
So when you start feeling you are belonging to, and for you are looking at the elder sister or something, like things are happening for the elder people in the family, and then subsequently you are also getting that. So probably you are involved more into the whole physiological thing. So
exactly.
thank you so much. So what role can pediatrician play in strengthening the menstrual hygiene awareness in the school setting? What are the disadvantages of poor management of menstruation? And we have to be short now, Radhika.
Yes,
Okay.
ma'am. Ma'am, health education in schools, we can deliver lectures, awareness programs for the sessions by pediatricians for mainly 9 to 14 years old boys as well as girls, so that they get the correct information. Even sex education can be given by a pediatrician or a gynecologist in association with the school. Second, we have to ensure that the schools are equipped with proper toilets, water facilities, and changing pads, this area, pad disposal bins, and everything, so that it becomes period friendly school. Second, we can train the teachers so that they can pick up problems associated with menstruation. They can guide in the correct way, in a very sensitive, in a sense, with actual sensitivity as well as with accuracy, correct information. And we can involve the counselors so that menstrual health becomes a part of mental as well as physical health programs. Third, we can advocate common like contact persons. We can become contact persons with ASHA workers and promote government schemes in school also, like distribution of pads, distribution of iron tablets. And the second question, the health issues, disadvantages of improper menstruation. Like, so physical problems can be urinary tract infection, one, because of improper usage of pads, not changing pads regularly, hand hygiene. Second can be anemia. Then chronic problems, there can be reproductive tract infections, there can be pelvic inflammatory diseases, there can be chronic pelvic pain or menstrual irregularities, leading subsequently, as it was being discussed, as in tribal areas, uterus gets damaged by such kind of measures, infertility issues. Apart from that, mental as well as physical and social stigmas are there. We should be able to remove them. And one more important thing that I would suggest is, because of school absenteeism, the girls are being absent. So it is increasing, it is contributing to the wider education gap between male and female. So I think these are the challenges. Thank you. I think I have been
Thank
quick.
you so much. Yeah. So, Mitu ma'am, have you noticed any change in the students' behavior, openness, understanding over the years regarding the menstruation? What do you attribute that to?
Yes, ma'am, because awareness is there everywhere. Um, Thanks to the internet, even children knows more than us sometimes. So they are fully aware, but yes, the right kind of decision, the right kind of choice that they have to make, or in a situation how they have to act. That is where our role comes into play. Information is always there, but then we need to guide them. As rightly said, sex education is a must. Yes, definitely we should start it little earlier, so that things become more clearer to them, and they don't it is not they don't feel embarrassed, whether it comes to a girl or a boy. Sometimes we have seen that a boy also has a problem because he goes out of the way to help a girl, and then it becomes an issue for the rest of the class. So it should not be like that. That is what we are trying to find out how we can go about it. But I think more or less, the entire student faculty is very much aware. They're very positive, and if they need help, they do come to us. They go to their counselors.
Thank you so much. Vijayalakshmi, how do your school currently support girls during the menstruation in terms of access to? Probably you answered that. What are your expectations from IAP in this regard?
Okay, ma'am. Uh, I think most of the schools supporting in this way that mainly in government schools, sanitary pads are matlab distributed, and iron capsules also distributing. I think मतलब मेरे knowledge में जहाँ तक है, I don't know 100%, but government
नहीं
school
नहीं,
में
आयरन भी मिल रहा है, क्योंकि आपके ही जो स्टूडेंट है उनसे हमने जो पूछा था ना, बस ये बात थी कि वो गायब हो जाते हैं, वो ले लेते हैं, वो खाते नहीं है, ये सबसे बड़ी प्रॉब्लम
हाँ
होती है, वो
एग्जैक्टली
गायब हो।
एग्जैक्टली
हाँ,
वो
वो प्रॉब्लम,
फैसिलिटीज स्कूल की तरफ से तो है, लेकिन
वो
मेरे
मिलते,
एंड
वो
से
अवेल नहीं करते।
एग्जैक्टली वो लैक ऑफ अवेयरनेस है कि उसको यूटिलाइज कैसे करना है, कि और क्या उसको फेंक देना है, कितने टाइम में, मतलब किस तरीके से कंज्यूम करना है चीजों को। वो चीज कहीं ना कहीं लैकिंग है। स्कूल अपने एंड से काफी एफर्ट करती है, जैसे उन लोगों को कीड़ों की दवा होती है, वो सारी चीजें प्रोवाइड की जाती है। मेरा एक्सपेक्टेशंस तो बहुत हाई है, हाई मतलब हाई इन द सेंस कि प्रिवेंशन इज बेटर देन क्योर, आई थिंक। तो जहां तक हमारा अप्रोच है, अभी तक तो 300 फैमिलीज है, तो वो उतना लिमिट नहीं है। मेरा तो है कि बहुत ज्यादा से ज्यादा लोगों तक अप्रोच हो। तो आईएपी के सपोर्ट से जैसे हमारी फैमिली सोसाइटीज के जो बच्चे हैं, उन्हें भी कहीं ना कहीं लैक ऑफ न्यूट्रिशन है, मतलब नॉलेज नहीं है, या उसको जो चीजें मदर समझाएंगी वो कम समझ में आएगी। जो चीजें यदि स्कूल में प्रिंसिपल बता दिया या क्लास टीचर ने बता दिया, कोई डॉक्टर आकर के वही चीज गाइड कर देते, तो उसके दिमाग में फीड हो जाता है, जो मैंने फील किया है। तो आईएपी के सपोर्ट से यदि हम स्कूल तक वहां तक हमारा अप्रोच हो, कम्युनिटी इंगेजमेंट हो, और हर बच्चों इंक्लूडिंग मदर्स, उन्हें भी इस चीज के लिए अवेयर किया जाए कि उनका लाइफ स्टाइल जो है वो बहुत ही बिगड़ रहा है हर घर में, हर बच्चे का। तो उस चीज के वहां तक हमारा अप्रोच कैसे हो, कैसे हम उसको गाइड कर पाए, क्योंकि ये पीसीओडी का केस है, वेट गेन ओबेसिटी का केस है, या एनीमिया है, या वो लोग जो पैकेट फूड खाते रहते हैं उसको कैसे अवॉइड करना है। मतलब हम सभी लोग यहाँ पर हेल्थ एम्बेसडर हैं, हम उन बच्चों को क्यों नहीं एम्बेसडर बना दें, उनको इतना ट्रेंड कर दें कि आपको ये चीजें करनी है, आपको अपने क्लास को मॉनिटर करना है इन द वे, इन दिस वे। तो वो ज्यादा मतलब इरेडिकेट हो जाएगी, जो इश्यूज है ना उसको प्रॉपरली हम उसको इरेडिकेट करने के लिए सफिशिएंट वो चीजें नहीं है, जब तक हम उनको हर घर में मदर को एजुकेट नहीं करें और प्रैक्टिकल वे में। तो आईएपी से तो मेरा ये मतलब एक्सपेक्टेशन
Thank
है।
you so much, Vijay Lakshmi. I mean, this is always good. You are having expectation for the others' cause. That's a great thing. Anjali, how to handle the period poverty? And do you collaborate with the parents or school management to reinforce the menstrual hygiene education at home or through social program? Anjali? Anjali?
Yes, ma'am.
So second part, more or less you have answered, but the first is how to handle the period poverty or role of NGO. So probably you have somehow answered that, but just a summary.
Ma'am, actually educating on one hand, nourishment on the other hand, and providing the sanitary pads. These are the three major things. And Gunj, as an NGO, they are trying their best to provide all the knowledge and information and facility. But still, government support and government also need to, because the problem is need is much more than um, the facility we are getting.
Anjali, I really want to know only one answer from you at this juncture because we have to quickly wind up. So the thing is, what about menstrual cup? When I was like evaluating it, I thought it's really a very, very kind of cost-effective thing. So why Gunj is not trying to get the menstrual cup for the poorer population? I think it's more hygienic, it's more doable. So what is
Ma'am,
your experience?
basically, Gunj, what they are doing, they are bridging the gap between urban and rural India. They are collecting the stuff from the urban, the second-hand material, like the kapde, khilone, jute, parde, furniture, clothes, and everything. So they are getting the second-hand material from the cities,
Okay, it's a
and
kind of recycling. Okay.
and from that they are like they are fulfilling the needs. They are trying to bridge the gap. And basically, they are using the second-hand material as a parallel currency for the development of the tribal and village people. And not just a piece of cloth is also one of the campaigns. And under this, whatever material, whatever clothes we are getting, in that we keep the cotton cloth separately. We make it a proper sanitary pad, which is basically a piece of cloth having a little small pieces of cloth inside. They are properly shaped in a particular size. They are washed and dried and checked for any metal. And
We need the cloth.
they are only providing cotton cloth because
Then
they don't.
how we can donate our cotton cloth for this program? The people in
Ma'am,
this
see, in cities, we organize awareness come dropping collection centers, collection camps, which is a one-day program. We are also organizing collection camps in the schools, and there we collect all the stuff. And we, in our leaflets, we encourage or we tell people to give their cotton dhotis and razai covers and all the cotton stuff to Gunj. And also the schools also they are giving the stuff from the school, like when the session ends. We have lot of things from the schools. Every after every session end, all the children they change their bags, bottles, tiffins, uniforms, shoes, and they buy new ones. They are not torn, they are not spoiled, they are in the usable condition. If we give it to Gunj, then Gunj helps these children, also the village girls and students, to have a proper like clothes to wear while going to the school, having the all the we give them the school kit in which we have chunniyon ki bani hui dari, and there is a school bag out of the old used torn jeans, oversized jeans, and we are making notebooks from the one-sided printed paper from the offices, and a lot of unused papers, and one part is the sanitary pad. So it is a total, basically,
Yeah.
we are also saving the urban India to get their waste into the landfill sites and overall increasing the problems of the cities.
Okay, thank you so much, Anjali.
Thank you.
Tulika, what are the lacunas in the government policies?
I think she messaged, she left. Is she there?
Okay, so now, Nana, you were not connected at that time, so please answer the previous question, and also this is almost similar question.
Right. Am I audible now?
Yeah, yeah.
Yes.
Yeah. Okay. So I was just stating that, in my entire clinical practice, I have seen both the cases. I have seen male teachers from government schools who are very concerned about their female students who have just had their first menstrual cycle. There are teachers who come and say that, since her age of menarche, she's having some behavioral problems. On the contrary, I have also seen students who are not comfortable around male teachers around or while they are on periods, because the teacher has passed some comment or he has asked them to not do a particular thing because they are girls and they could be menstruating. So it is quite difficult to say that whether male have a better attitude or a poor attitude towards towards the teachers, basically towards the students. So coming to the second part of the question, we usually tend to tie the puberty, that is the menstrual cycle, and our sexual behavior, or the fact that the child needs sexual education and menstrual education together. So that is a very very wrong tie-up. A child may need sexual education much before they need the education for the puberty, be it boy or a girl. I have seen cases where I have seen children who are 5-year-old or who are 6-year-old, who have been brought in by their parents upon the request of the school because the child has been, touching the private parts of the other students, or who have been flashing their private part in the school setup.
तो 40 का चढ़ा
And
दिया
on
आपने
the
वो कल
on the
20 का वो
contrary,
चाह
there
रहा
are
हाँ रोज रोज करो
Kindly mute yourself, all attendees. Please mute.
On the contrary, there are other students who have achieved their puberty, be it male or female, or and they are sexually, and their sexual behavior, their sexual attitude is much mature. So first, let's disconnect this association that we have, that menstrual education or the pubertal education per se and the sexual education should go hand in hand. Uh, yeah, so I like to wind it up here.
Okay, thank you so much, Naina. It was very important information. Swati, this is last round actually, only last questions. These are last questions for the session. Is it true that height gain is directly related to onset of menarche? What to be done to optimize height gain in a child embracing early onset of menstruation?
Yeah, ma'am, I'll go very quickly about it. So basically, the hormones which bring about the changes in the body, the same hormones, they elongate our bones and fuse it. That is why we say that after you start with your periods, you do not gain much more height. What you have at the onset of periods is almost your final height. So that is why it is important that, if they start with early puberty, the parents need to consult their pediatrician or pediatric endocrinologist to see what is the height potential of the child, because sometimes when they start with their puberty early and they have their periods early, they end up being short. So that is why the height has been associated with menstruation. And the children, again, as I said, that those who start with their puberty early need to be evaluated as soon as they start with the puberty, not after they have had their periods, because by that time they would have had almost their final height, and sometimes they do not are not very tall and they end up being short. So that's how it has been associated basically.
So is there any role of hormonal test and all those things?
Definitely, we have GnRH analogs, which we are using quite often these days in girls who are starting with their puberty early. Because thing is that their height is not that much that they would have a good final adult height. Also, they are not that mentally mature enough to understand their body changes at that time. And they are not very much aware about the good touch and bad touch. And sometimes they have behavioral issues and mental issues because of starting with their body changes early, which they do not require at that time. So that is why we advise parents, and if the parents are very worried and the child is very early in the puberty, to delay the puberty for some time being, so that it allows the child to develop mentally as well as physically.
Okay, thank you so much, Dr. Swati. I will call upon Dr. Kiran Agrawal. She is there and she is writing so many things and informing us. Dr. Kiran ma'am, she is most senior pediatrician over here and she is very accomplished. Ma'am, आप हो क्या यहाँ? Dr. Kiran Agrawal.
हाँ मैं हूँ स्मिता
हाँ
I'm
जी
somewhere so
unmute
I
करिए
cannot put my video on. I'll just
yeah
speak, right? To my
okay
can I ask Swati, is this because I was once I was being I mean I had my administrator in my government. I'm a retired government servant, so I was actually interviewed by the. I just went to some file to him, and he just took almost half an hour interview with me. He was actually very fond of showing that he knows very things and all that. So he was just asking me if the menarche is happening early, so all the children in future generation will be small statured.
Content,
So
yeah.
is it Swati, is it not like that, that if they have early puberty, so growth spurt also comes early?
Yes,
Can,
ma'am. Good afternoon, ma'am. Yes,
if I
that
am
is
wrong,
definitely true. No,
yeah.
no, ma'am, you're absolutely correct. So that is what we tell parents, that
Huh?
because the changes which are supposed to happen at 11 or 12, if they're happening at 8 or
Hmm,
9, so you are starting that growth spurt
hmm,
at 8 or 9. तो आपकी जो हाइट 8 या 9
hmm,
साल पे है और आपकी जो हाइट 11 या 12 साल
hmm,
पे है, उसके ऊपर जो ग्रोथ स्पर्ट
hmm,
आएगा वो वेरी करेगा, और जो
Hmm.
उससे फाइनल हाइट
huh,
निकलेगी वो डेफिनेटली वेरी करेगी. So it is not
huh,
that
huh.
every
So it
child
is
would
not
turn up
a,
being
huh,
short, but most
huh,
of
huh,
them do.
huh, huh. So what if they come for the evaluation? So what you can do if they have early puberty?
So, ma'am, that depends on a lot of factors. That at what point they are coming to us, what is their stage of
Hmm,
puberty, what is the growth spurt that they're having, what is their bone age. So, if the child
hmm,
is of a good height, the bone age is also
hmm,
matching, and we are sure that the child is
hmm,
going to reach a decent height on their own, we do not intervene,
hmm,
we just observe.
hmm,
It's only in
hmm,
those we
hmm,
are sure that they are going to end up being short or they are not mentally prepared for the changes that are happening. We offer them treatment.
hmm. Yeah,
Okay, thank you,
maybe some
ma'am.
lifestyle change or something like that can be given. And yes, one more thing actually, I just wanted to just message that still in the tribal population, because the every now the government is very, I mean, proactive on. Even I was in one of the ICMR committees, and we were told that we don't have the funds, but we have the funds in the tribal section. If you approve anything, any project on that, so we have funds in the tribal section. So government is promoting the tribal population health or every aspect. Very, I mean, they are very proactive on this. So I just want to tell you, the many, because in Bangalore also, this was also, I just went for a supervisory visit on a ICMR project to Vellore. And they have 50,000 population nearby, and they have for each and every family member, they have computerized data for the whole family. You know, there's such a great opportunity to do so many things there. The menstrual hygiene, the menstrual things, they are really horrible in them. What we do there? They really need
Thank you so much, ma'am.
some videos, the health education, the dietary advice, but that all that has to be modified in their own language, maybe, or what they can understand, the food they eat. Anyone can answer that?
This is whatever you are saying is so important for all of us. And I think Indian Academy of Pediatrics is the platform which should take initiative and should utilize all those available resources and connect them with the proper needy population. So that is one thing which actually OBEB of the central IAP should actually delve upon, and they should go through that. Dr. Alok Bhandari, I would like to comment from Dr. Alok Bhandari if he is here.
He
Ma'am,
messaged that
he has left, ma'am. He
he
had
had
to go
Okay,
another
for some other
meeting.
meeting.
okay. So,
Dr. Rashmi Kanti is there.
Rashmi Gandhi, Dr. Rashmi Gandhi,
हाँ जी मैम। मैम
coming
बहुत
from
अच्छे।
a government.
Yeah, I am coming from a government hospital. I see different set of population, but mostly what I have learned from my gynecology department people, there is a scheme which gives Udan scheme, which gives to all the Delhi government school girls who are studying monthly pads. Distribution is there for all the girls, and those who are not able to study for some reason, from for their use, Anganwadis are providing them pads on a monthly basis. This is what I was told by my gynae department colleague, and they have been carrying out these menstrual hygiene camps and discussions and awareness sessions for a long time now. So, and that we are doing under your leadership, it's a very great thing.
Thank you so much. And thank you so much, Dr. Rashmi. And I would like to call Dr. Devendra. Dr. Devendra Sareen is there. If he
Yes,
wants to. Yeah.
yes, madam. Everything was very informative, and this is the need of the hour. And we have to nowadays, whenever the mother is there and we have some time, then we can ask the mother about the menstrual hygiene to teach the child, because mother is one of the best guide for the child, for the girl child, because she has much faith in mother regarding this all these things. Now, very secrets of life she can share with the mother. So we have to take in confidence the mother, and then we can explain them. And nowadays, in every branch, going for the school health and telling the parents also, especially we are teaching the parents that they should devote time to the whatever the child says and impart the education to the child, including the sex education. So this is a wonderful drive from your side, madam. This is also a very, very illustrative talk, very useful. Thank you. Thank you, madam.
Thank you
Thank you
so
so
much.
much. Thank you.
Always you are joining our program. We are really thankful to you. Hannah Radhika and
Ji, ma'am
Puneet.
ji.
Dr. Puneet wants to say something. He backed off as a panelist.
It was a excellent meeting, ma'am, as always. This is cross-disciplinary as our all other activities we have involved from different streams. It was an excellent program, and as always, IAP is balancing everything. We are working for the community also, and we are working for the doctors also. For whether it is anemia, obesity, or today it's menstrual week, we first celebrated with the community with the SNS. Now today we are doing this Zoom meeting, and tomorrow again we have a program with media. So we at IIP West Delhi under your leadership is have been trying to balance out and trying to act in different ways. Today's was also an interesting and enriching discussion.
Thank you so much, Puneet. Yeah, tomorrow's program but has been postponed, so it will be next week. Dr. Rashmi Gandhi was actually, Rashmi Grover is probably, she also left. Rashmi, Dr. Rashmi Grover. So both were our representative IAP West Delhi in the small media group. But the thing is, it is being postponed for next week, and we will have a bigger panel for that discussion. That is what Dr. Mahajan said me. And anybody else wants to comment?
Madam, there was one suggestion that in
Yeah.
the dissertations we give to the usually our students now, to the girl, these our candidates, we can give this topic about the knowledge of the these adolescent girls about the menstrual hygiene. What are the demographic factors, maternal education effect, nuclear family, joint families, like that, all the demographic variants and all these. Na? This will be a very important one. Na? At places we can give it, and then we can find what is the overall impact, and then we can continue with that in the urban rural areas also, all the areas, various socioeconomic status, and the art students and the other science students and everyone, like that. It can be a good studies, can be.
से
And from
एक ना
pediatric
हम
point
जो
of
अभी
view,
ये वो
ma'am,
करेंगे, हाँ, what?
from
पुनीत?
pediatric point of view, in disorders of menarche and menstruation, we must not forget the systemic illnesses, not only endocrinal, like chronic infections, tuberculosis, mental health issues, anorexia nervosa, all these also affect. So all these have to be screened
Yeah.
whenever somebody
And
presents with
screen, yeah.
delayed puberty or this. Those
Very
So
things are
I
to
well
be.
think
said.
Radhika
Yes.
and Dr. Vijay Lakshmi Puneet, my suggestion is probably we should start a kind of initiative where in our one of the program, maybe WestCon, as a part of WestCon, we should go for the competition on the first menstrual day greeting competition, and whoever makes whatever they make, we will start making a greeting for the first menstruation period. How
Great
it
idea, ma'am.
is?
Yes,
Great
madam,
idea,
very
ma'am.
good idea, madam. Just like in the breastfeeding week, we are having for the undergraduate student, nursing students, and all. We can have the competition like this. Very good,
Competition,
very good
yeah.
idea.
Yeah, we'll give a competition where you have to decide how you will celebrate menarche. The
Yeah.
different ideas to celebrate menarche, that should be the, I think, the
So that one school program we can actually ask people should make, girls and boys. Okay, under the, and this it should be done under the some biology teacher or somebody should actually guide. So there should be a team. So a team should prepare a poster or greeting, and which we should evaluate. So I think we should try for that, Radhika, a bigger task, but I think this will be a good initiative, right?
right,
Anything,
ma'am.
Dr. Leena actually left probably. Dr. Leena, you left?
I'm
Dr. Anjali,
I'm there, Dr. Smita, listening to the wonderful panel.
final,
So
final,
mesmerizing. And what
final
different
comments.
kind of people from such diverse fields you've managed to get together, and it's so wonderful to hear their perspective, about what the government is doing, and the distribution of pads. It's really very, and so much needs to be done. I mean, that we have realized that I really didn't know that Goonj only recycles things. They really can't give, like what you just mentioned about the use of a menstrual cup. That would be such an easy way of ensuring a better menstrual hygiene. So I think some agency should take up that, when we have so many people wanting to do something good for the society. I mean, this is such a nice thing. I mean, instead of, and Goonj is trying to do what it can, because they will only recycle what people are
Take
giving
it.
them. Yeah, yeah. So that point was very interesting to know that. I mean, we would have thought that they could be able to recycle that, but since they don't get that, so they can't give it to the communities that need it. So I
Actually,
think this
Goonj
is
is
very
doing
nice.
very well. They are getting lot of material, and they are really doing very well. Their warehouses are full. They are getting lot of material.
Yes, you're right.
So,
But like
and doing
what,
very
yeah, what Dr. Smita was mentioning was like to do away with cloth completely will not be a easy solution. And they
definitely.
with whatever they have, they have managed to recycle it and give it. I think that's really commendable.
Exactly.
So these are the kind of things, people like we are in a corporate setup, we won't know about these things. So it's wonderful that on this platform we got to meet people from such diverse, professions who could tell us a
Exactly.
lot about, how to meet out, to reach out to the community. I think it's very, very nice platform. Thank you very much for having me here.
Sir, Amos sir, if you are there. Amos sir is the like pivotal like Vijay Lakshmi for SNS. So
Yes, ma'am. I am very much here, and just 10 minutes or 15 minutes back, I have joined, and I was listening. And thank you very much for connecting the group like IAP with SNS. We are a very small group, and we are really feeling blessed that so many doctors, first time, so many doctors visited our center throughout the 5 days. It was a really impactful this event. And when we talk with the mothers or the children, our children, they are feeling like कि चलो बहुत अच्छा हुआ. Normally we used to just distribute the sanitary pads and we were not able to deliver such a informative kind of knowledge to them, because doctors, naturally doctors can deliver much better from the other people. So this time it was really impactful, and we are very much sure with the help of IAP, and we want to do many more things for the children, because we are catering children and their mothers, and there are a lot of health problem, and we never looked up in depth so far, because we are focused on education only. We are 8 years old now, and our core area of it was education. But now we feel, after the being associated with IAP, now we are feeling health is also equally important as education. And many of our girl child do not come to our center, do not go to the school, then we can feel what is the pain behind that absence. So, and thank you very much to Vijay Lakshmi also from our side. She has taken a lot of pain for throughout the 5 days. And thank you very much. Special thanks to Dr. Smita madam, Dr. Radhika. Thank you, ma'am.
सर आईपी ने भी ठाना है कुछ, चलो कुछ अच्छा करते हैं.
बिल्कुल सर, बिल्कुल 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 बिल्कुल. बस थोड़े थोड़े एफर्ट से ही कुछ होता है. कई बार हम लोग
बिल्कुल सर, छोटे
सोचते
छोटे
हैं ऐसा
इनिशिएटिव
होगा तो
बिगर रिजल्ट निकलते हैं.
हाँ, कई बार हम लोग छोटे छोटे एफर्ट से बड़ा बिग इम्पैक्ट क्रिएट कर सकते हैं. थैंक यू पुनीत सर, आप हमारे हर पेज को लाइक, पोस्ट को लाइक करते हो, और पहली बार
डूइंग सच वंडरफुल जॉब सर.
हाँ हाँ, थैंक्स फॉर ऑल द अप्रिशिएशन. थैंक यू सर.
मैम इसमें यहाँ पे उषा जालपुरी मैम भी हैं जो बहुत शिद्दत से
Usha ma'am.
She's here.
Yes, yes.
Usha ma'am, please comments from you. Usha ma'am, unmute yourself.
Am I audible?
Yeah, bilkul aap audible.
Yes. This session was very impactful. All the questions, all the inhibitions have been touched. I'm so fortunate to have. The stigma has already been taken out from the minds of the society. But मुझे एक बात याद आती है, जब मेरी बेटी के irregular periods थे, I took her to endocrinologist in AIMS. तो उसने उसको पूछा क्या बच्चा होगा मेरा आगे. This was really great. उसने सीधा ही उसको पूछा क्या मेरा बच्चा, और दूसरी बात पूछी मेरी माँ के बाल नहीं है तो मेरे क्यों बाल है. तो आजकल लड़कियां बहुत सब कुछ जानती है. They know each and every part of it. Yesterday when you put some questions to the audience, a girl was completely full of information about this. So we have to, a mother has to take the initiative. She has to inform, educate her family members about it so that they will not feel embarrassed. And we have to tell them that there are infections will grow if they keep the pad for so much long time. And this will affect on their kidneys, on their health issues. And disposal
Very well
of
said. Recurrent UTI may lead to the further problem with the whole system.
Because
Yes.
I have seen they keep the pads for so many hours. चलो चलता है, लेकिन this has to be, they have to be taught about it, that this is not good, and disposal of this sanitary pads should also be taken. I am very thankful to you that you have come to our organization and given so much valuable knowledge to the ladies and girls. Thank you so much.
Thank you, Usha ma'am. Actually, it was very interesting, Vijay Lakshmi. In this song, one of my yeah, hospital colleague. So I was just let them listen to this because whenever I make a song, so those are the people who first approve. So Kirti, Lina ma'am. So she was listening very carefully. I saw her doing this. I said, Kirti, why you are listening it so intently? So she said, no, ma'am, इसमें तो काफी इंफॉर्मेशन है. मैं अपनी बेटी से बात करने का सोच रही थी और मुझे समझ नहीं आ रहा था कि मैं उससे बात कैसे शुरू करूं. तो मैंने कहा ठीक है ये सॉन्ग सुनाना और वो फिर उसके आंसर कर देना. तो शी एक्चुअली टुक दैट सॉन्ग टू हर डॉटर. एंड देन शी टोल्ड मी कि उसके बेटे ने भी सुना पर उसने बेटे को उतना नहीं बताया पर बेटी को बैठ के तो बेटी पूछ रही थी कि अच्छा उसमें इन्होंने ये क्या बोला ये क्या बोला. देन शी वाज एबल टू टेल एवरीथिंग very nicely. So it was like these kind of song makes a bridge between the when how to start a conversation on particular topic which is not connected. So this is how it is.
Definitely, ma'am. Such initiatives help a lot. In fact, that
Yeah.
book that Mrs. Tulika was, I think, mentioning the
Tulika, yeah, she is
Menstruopedia.
writing many books actually.
It is a very good book. The comic
Very
book, the
good.
Menstruopedia, which she mentioned, is very good. Actually, I bought it from my daughter also. So
That's great.
it is good to start from there. Such things, your song or such, no, in a lighter way.
Actually,
In
I could not get that video today because
there's
we
a
could
book.
not be able to.
There is a book,
Songs like these,
cartoon book, Menstruopedia.
they get connected more easily. If there are songs, Nukkad Natak, these workshops, these things connect with
They
children.
connect.
Yes.
It should be
Okay,
circulated
so
in schools too.
Vijay Lakshmi wants to say anything or we can now close the session.
Yes. I think it should be circulated in schools too, this song. It will be very helpful for those children.
It will be in YouTube day after tomorrow till Rajbir if he makes today that video is complete. Then tomorrow you will get lot of information over there in the video itself.
Yes.
So okay, Radhika.
Thank
Vote
you
of
so
thanks
much,
कौन देगा? पुनीत या
Dr. Puneet.
Thank you.
Choose.
Thank you, everyone. It was a great, enriching discussion. This is a time when there is actually information overload. We were talking of information. Everyone has the information. We have to give guidance. So such kind of meetings do help a lot. I thank everyone. Heartfelt thanks for everyone for joining in, for sparing your time. Uh, Thank you so much.
We are
Thank you,
And
Dr.
I
Puneet.
thank Radhika and Puneet.
Thank you so much, ma'am. Thank you so much. Thank you, Dr. Leena, ma'am.
Thank
Thank you,
you.
Vijay Lakshmi ji.
Bye-bye.
Thank you, ma'am. Thank you.
Thank you.
Bye-bye.
Thank you, everyone.
Rohit is doing great
Thank you,
job with
everyone.
us.
Thank you so much. Thank you.
Thank you,
Thank you.
Dr. So
Rohit is there?
Radhika, yeah, thanks to Rohit.
रोहित है?
पता नहीं भाग्य होगा चलेगा ठीक है.
मैम
He
उसका
had two meetings.
हाँ उसकी कुछ मीटिंग्स और थी मैम.
नहीं but he is doing quite well ना हमारे
हाँ
Yes,
मैम
लिए.
वो एक
he is
मिनट में
supporting
सब कर
definitely.
देता है.
He is doing.
Thank you so much
We
everyone.
have
Have
good
a
team,
good
Thank
Dr.
evening.
you.
Leena.
Bye-bye.
We have great team. Thank you. Bye bye.
Very nice.
Thank you, ma'am.
Bye-bye.
अब कौन Puneet, you will finish
Yes,
this
I'm
meeting.
sure. Okay, ma'am. Thank you.
Okay, thank you. Puneet? Puneet? Dr. Puneet?